Hi, welcome everyone. Just letting everyone in the room. Great to have you join. So lovely. So we've just got a few more people entering. Great. Excellent. All right, we're up to 21 people. Lovely. So lovely to have you join today. We aren't going to keep this part right at the beginning in the recording, but we will record the main presentation part, and then we'll also stop recording when we get to the Q&A. So you just feel free to ask anything you want. What would be lovely is if everyone wouldn't, or whoever would like to, be lovely if you just pop in the chat who you are, where you're working, and that would be lovely to get an idea of our audience today. So fantastic, great. So Bernadette, shall I kick off and introduce myself? So my name's Scilla. I'm a professor of occupational therapy and I lead the academy. I designed it and have led it for the last few years. So lovely to see your messages popping up in the chat. Great. And I'm part of the research capacity building theme, which is within the applied research collaboration. So you might have heard of like biomedical research centres or School of Social Care Research, those sorts of organisations. They're infrastructure or schools funded by the NIHR. And the applied research collaborations, there's 15 of them in the UK. And basically people join in as partners, for example. And one of the elements of all of the ARCs is that they put on some capacity development opportunities. So within the South London ARC, we developed this research academy, and we're very pleased to open it up to anyone to take part. It's free of charge, and it runs between January and June next year. So this is a bit of a briefing to invite everyone to apply. We'd be delighted for you to have a place on our academy. So lovely. So as you can see, there's a few quotes from previous year's participants sharing with you a little bit about their experiences of taking part in the academy. It's very flexible, so I'll explain a little bit about that as well. And in the chat, I'm just going to put a link to the webpage, but this is probably you've already been signposted to this, but that gives you the link to more information and the link to apply. Lovely. So I'm just going to have a quick glance through to see who we've got with us. Lovely. So we've got people from all around the country. Excellent. And colleagues from other ARCs and other universities and clinicians. Wonderful. Great. Okay. Fantastic. So I'll just invite Bernadette's just turned off her camera, but Bernadette, would you like to just introduce yourself? Sorry.
Sorry. Hi.
Yeah.
Yes, I'm Bernadette, and I'm the one you probably got an email from. And I help Scilla. I'm the administrator for the course, so I help Scilla to run the event, and I do all of the recordings, upload the recordings, so that for each of the lectures, so that people can have an opportunity, if they can't attend all of the sessions, to watch the recordings.
Fantastic. Great. Thanks, Bernadette. Yeah, absolutely couldn't do it without you. So I'm going to head on to the next slide, please, Bernadette. So thank you. So I've introduced myself. I'm also the clinical academic training lead for South London, in case that's of relevance for you. If you're applying for any career pathway awards within NIHR, that's another role which I hold. My main job, my day job, is as head of graduate research school and head of research at Kingston University in southwest London. So that's my main position, and I have research grants, NIHR and the EU grants, and PhD students who I look after as part of my main job. Great. So just to say, we started the Academy initially in 2022 for people from our own South London area. But then in 2023, we opened it up for the London area. And now, since last year, 2024, we opened it up nationally. So we do say, ideally, you're part of a partnership within an ARC. But honestly, if you're not, if you're just working, wherever you're working, we're really happy for you to join. So I think in one of the questions it says which ARC you in, but you could just link to the one which is local to you if you can spot it, and if not, just put other and let us know where you are. So we aren't necessarily open for international people to apply, but sometimes people are on, say, for example, a Wellcome Trust Health Professions studentship, and they might be based in Africa. So, anything allied, we're very pleased to support as well. So we'll actually start the Academy on the 15th of January, and this will be online. And that very first session, we teach you how to use action learning sets, because part of the provision is an action learning set. And we'll be getting you into the groups who we think you would suit and teaching you how to use that. Now, when you do the application form, you'll find that there's a kind of grid at one point showing different levels of experience. And some of you might have applied already, which is great, but you'll see there's a range of experience, and you just pick the level of experience you think suits your experience the most closely. Don't worry if you don't get it exactly right. It just gives us a chance to group you with people of similar levels of experience for the action learning set. So then we have, oh, sorry, could you just go back a slide, Bernadette? Thank you. So we also have a lecture program. So typically it's about 15 lectures over the Academy between January and June. They're 1 hour long from 1 till 2 o'clock. Occasionally it might vary, but we'll let you know, just because if the speaker's not available exactly at that time, sometimes we move it 15 minutes or half an hour or so. So those will be probably on Teams, maybe Zoom. We'll see which platform we decide to use. And we record every single one, and we give you access to the recording. So we don't want you to share them outside of your own group, outside of your people on the Academy, because obviously people can join another year. But it's so if you're busy, like if you've got patients you had to see, or you're got teaching you had to cover, or whatever it might be, those are available to you, and you can catch up. And we also have an expectation that each of you will be allocated to an action learning set, and those will be asked to meet 10 times over the Academy period. So it doesn't start straight away. We give you a little bit of time to get organized. And when we teach you how to use action learning sets, we ask for one person in the action learning set to offer to lead the group, but we'll support the leads. And you're on a leadership academy, you might like to put your hand up for a leadership opportunity. Good thing for your CV. So we'll explain more about those as we go along, but you don't have to make every single one, but it would be great if you can make as many as you can. In addition, there's an opportunity for a 1 hour mentorship session, and I'll explain more about that in a minute. So next slide, please. So who's the Academy open to? We're very flexible on this, but generally people who join are academics, researchers, either in practice or in institutes or in universities, any clinicians who have an interest in research. You might be supporting others to do research, you might just want to build your own knowledge, or you might be a full-blown clinical academic progressing along a career pathway. Doctoral students are most welcome. Quite often doctoral students have a lot of experience behind them, but sometimes they're more junior. So wherever you are at on your journey is fine. And we also encourage PPI, so public patient involvement or engagement representatives, to join. And they are a great part of our groups as well. So we don't have a cap on numbers of places. Generally, if people are keen to take part in the Academy, we're very pleased to offer you a place. It's easy for us to scale up. We're particularly keen to support people from diverse backgrounds. And when you apply, we try and keep the application form fairly short. It won't take you too long to fill it in. We basically, at the end of completing that, we have a little pop-up at the end, and we ask you to do an anonymous EDI survey briefly at the end of applying. So they're not connected. The EDI survey is anonymized, but NIHR is very keen to always know whether we're managing to achieve diversity in terms of all the different underrepresented groups. So we do really ask that you do fill in that, but we won't have it linked in any way to your name or be able to know who you are. So next slide. So these are the reasons why people join the academy. We've shifted it slightly as we've gone along to try and meet people's needs from the evaluation, but I'm just going to give you a minute to read through these 6 points just to help you think, is this for you? Okay, lovely to see some PPI members also in the chat. Fantastic. So as I say, it's a leadership academy. So we're not purely around helping you design grants and applications for funding. That's really quite a minor part of our academy. It's more about building your leadership skills in research. So you will definitely get top tips from all the different sessions as we go along. So when you apply, you'll be asked to pick 3 of these, which you're particularly keen on. That just helps us in shaping the academy going forward, making sure we're meeting people's needs. So next slide. So this is the timeline. So we opened up for applications on the 14th of October, and the link to the timeline is in the chat. I've just popped it in again for people who've joined slightly later. Today is our briefing session. We close for applications at 9 o'clock on the 7th of November, and then we'll try and let you know as quickly as we can. So I should think we'll have let you know by the end of November if you have a place, because then you can just schedule it into your diaries. The academy will run from the 15th of January through till the end of June. And we'll show you a draft timetable, and we'll share these slides with you as well. So or I think it might be that we put the slides on the webpage, or Bernadette will email them to people who join the meeting at the end as well, with the recording as well. So and then in June, we finish about early June on the lecture program and the action learning sets, but then we have a couple of weeks where we give you a link to our online evaluation, ask you to complete it, send a couple of reminders. And then at the very end of June, we have a lovely celebration event where we invite everyone who wants to come. I'm afraid we don't have a budget for travel or anything, but if you can come to King's College London on the Strand, we have a lovely room with food and drinks, and people enjoy meeting some of their action learning set in person. We invite our speakers, and people share a little bit more about what they got out of the academy. It's a very relaxed event. We also encourage people to bring anyone with them who you think might like to take part next year, so that they can hear about what people get out of the academy. So that'll be end of June on a Wednesday evening at 6 o'clock. Next slide. So what's the content of the lecture program? Okay, so first of all, we have some research leaders who share how they went about their journey, what kind of decisions they took, what things worked out, what didn't work out, and you can ask questions. So for example, we have Geeta, she's a professor of physiotherapy working in the NHS. We have Rick Hood, he's a professor of social work, and we have colleagues as well sharing their journey through trying to develop policy implementation in their field of research as well. So often people are research leaders in their own areas, so it's a great opportunity to hear from them. They all give their time for free. Next slide. So we also give you some skills training. So in particular, we give you a session on how to cost up grant applications. Obviously, if you're very knowledgeable about this already, please don't feel you have to join that session. But sometimes NIHR contracting can be a little bit complicated. So we have someone come who does that as her day job. So it's quite useful to hear from them how to go about it and how to you can ask any questions, and she offers her email at the end, so if anyone ever needs advice in the future. We also have topics, for example, from people from diverse backgrounds who have expertise in how to recruit from underrepresented groups into research. So it's great to hear from someone who has that type of expertise on how to build that, so that we can really try and help reduce health inequalities in our research outcomes. Next slide. Another area when we originally designed this academy, because I got together in an away day with colleagues and put this together for you, there were certain leadership qualities people felt they admired, and they were keen to learn how to build those in themselves. So we have a topic spoken about on research resilience. We have a talk about how to build research collaborations. And we also have a talk on how to make research impact, because these are all kind of qualities about successful research leaders where they're able to deliver on these types of things. We've also got Fiona Ross, who was on the government REF sub-panel, on the EDI panel, the panel looking at diversity of research in the UK. She comes to talk about how to build diversity in research leadership. Next slide. So we also have the action learning set. So you'll be supported to meet 10 times, and we'll teach you how to take part in an action learning set and how to lead it. So it's another skill set to have under your belt. Next slide. I was on the government panel for assessments of universities research, and a lot of the impact case studies linked to our health and social care providers and how differences are made in terms of research impact. So it's a great database to look up what research is being done in the UK on all kinds of topics you might be interested in. So I help you learn a bit about that. It is the way government funds a lot of research through universities in the UK. And so in addition to the NIHR funding awards, there's 2.4 billion spent every year through universities. So I give you a guided tour of that topic area from my experience of being on the government panel. And then finally at the bottom, you'll see you get an individual mentorship or coaching session. So what we do is we teach you the skills on how to secure this for yourself. You might already have a mentor or a coach, but this is an opportunity for you to reach out to someone you really admire, who's really very talented about your topic of research or your area of interest. And we give you a templated email and we explain to you how to go about it. And it means that you can reach out and say, I'm part of this academy through the National Institute of Research. You know, I really admire your what you've achieved in your area, and wondered if it might be possible for you to give me half an hour or so of your time just to give me some career advice and guidance. And often you need to say specifically some particular thing that they do, which you're interested to learn more about. So we get a lot of success from this. Quite often people are still meeting their mentors, because often the mentor's quite interested to learn from you as well. And sometimes you get invited onto grants or come and do a talk, all kinds of things. But it also can just be a very small stepping stone. Doesn't have to be a big deal as well. So people do this for free, but we do say if your mentor would like to come to the training event we do as part of the lecture program on mentorship and coaching, they're most welcome to come. And we have had some very interesting people join in the past, including some really inspiring researchers and leaders in the field. So next slide. Okay, so this is just a quick glance at the program. It's really based on last year's. I haven't quite had time to secure all of our speakers for this coming year, but you'll see all kinds of different topics here linked to what I was talking about. So the 15th of January, we'll be doing this session. The first one, ideally, it's an hour and a half. You can see the first session there will take place between 1 and 2:30, because we need a little bit longer to take you through the training for action learning. And we'll put you into your breakout rooms of your groups during that time. So please try and join on time on that very first session. After that, all of the sessions generally are usually 1 till 2 o'clock. They're all recorded, they're all online. So the second session, you'll sometimes see, for example, it's got a link to the person's specialist area. So palliative care is the background of the person speaking, Richard Harding. But you know what? You learn about all kinds of different topic areas. So if you think, oh, well, I'm not in palliative care, I won't go to that talk, you'll honestly miss out on hearing quite a lot, because if you want to be a research leader, you're probably going to be interested in building international partnerships. So please, kind of in a sense, ignore their specialism. Just listen for what you can learn from people. And I know people really enjoy his talk. He gets excellent feedback. So I'll do the session on the ref. You can see all of the topics there, which are the ones I was mentioning. So I'll just show you the second slide. So on we go. As you can see, we skip Easter and we skip half term. So you'll get breaks then, because some people have caring responsibilities or go on holiday, etc. And then towards the end, the last stage is doing the evaluation and then the in-person celebration event. So that's the lecture program. And then the 10 action learning set meetings can take part at any time during those 15 different weeks. Next slide. Okay, I might skip that one just because of time, because I want to make sure I get enough opportunity to get questions. So if you could go on to the next slide, Bernadette. Thanks. Oh, that's good. That is the next slide. So if you have any queries, Bernadette is on the generic email ARC short courses, because we run lots of different capacity building opportunities. So so really now I just stop sharing the slides and stop recording, and or Bernadette will clip the recording later. But I just wanted to come to you to see if you have any questions.